For medical assistant, it's very essential that you just make a good EKG trace. You don't have to interpret it. It's your duty to make a good EKG trace. For taking a good EKG trace, first you have to put the electrodes in proper positions. For that, we use the electrode tape. That tape, this tape is sticky paper, but it conducts the electricity, and this electricity will conduct it with this electrode, and is for the position. Each one is for definite positions, and that will carry the electricity is coming to the machine, and the machine amplifying the electricity that is being conducted from the body to the machine. And then this amplifier turns to the galvanometer. The galvanometer is transmitting the electric impulse into traceable impulse, and that is being recorded in the paper. I will show you later paper. First, let's start the position. You know the electrodes, we have 10 electrodes. You know that? So 10 electrodes, 2 on the leg, 2 on the arm, and 6 on the chest. It's right leg and left leg. Usually we put the electrodes is like this. It's the electrode we put is upward in the legs, upward direction. That will be upward. Medial side of the ankle joint. Medial side of the ankle. Put it here, 1. And medial side of the other ankle joint. Put it here. For the arm, we can put it on the medial side of the wrist joint, on the forearm, or on the biceps. Commonly used on the biceps. Even we can put it anterior part of the shoulder. But here, in this case, we will put it on the biceps. And this will be downward. The flap should be downward. It's like this. And another one is here. It's like this. Now arms and legs is set. Now I have 6 is the chest. For the chest, you have to palpate the intercostal space. It's the first one. The V1 is on the right side of the sternum in 4th intercostal space. First space is below the clavicle. First, then bump space. Second, third, and 4th. So it's the left side, and this is the right side. So we put an electrode, and this will be also in the downward. It's like 1, 2, 3, and 4. So it's the 4. It's here on the border. It's the border. It's the 4 is here. Okay. If you have a hairy chest, it's better to shave it. Otherwise, it might go off. But in this case, the hair is not that much, so we can we can skip the shaving if it doesn't go off. The V2 is on the right. First one is right side, second one is left side. So 1 and 2, V1 and V2. Now this is the 4th space. Go for the 5th space. This is the 5th space, and mid clavicular line. Mid clavicular line is here. Is the mid clavicular line. The 5th is here. Is you can for the male, it's just below the nipple. Male for just below the nipple is the 4th. Now 1, 2, 4. 5 is on the anterior axillary line. This is the 5th space. Here is the 5th space. So is on the 5th space is here. Check it. Put it here. That's the 5th one. V5. Then you just take this one on the mid axillary line in the 5th space is here. Mid axillary line in the 5th space. So we have V1, V2, V4, V5, V6. I have 1. and V3 is always in between V2 and V4. V3 is in between 2 and 4. Look, it's like in the middle of it. So if you check, it's all the 10 is there. 2 is in the leg, 2 is on the arm, 6 on the chest. Now this is the electrode. We have to clip this, and for the clipping, every electrode has been named here. It's like V6. So we will first go with the foot or leg. This is the left one, the left leg. So left leg will be, anyone, would you please help me? It's the left one, is left. Good. That's on the right. So is one is left, another is right. Now this 2 is left arm, would you please try to catch the left arm, right arm, sorry, you just put it on the right arm. Okay, whenever you, no, not like this way,
not like that,
yes, it's
this
downward,
way?
downward,
Like
yes,
that?
yes.
Okay.
So we have this one, and when you go, you have to put like this. Top, and the cord must be, the electrode must be very easy, and it must be loosely fitting so that it doesn't move. Now the chest one. We have the chest one. This is number 1. Anyone? Okay, I'm just showing you. The number 1 will go like this. Number 1 is like this. Then number 2 is here. Number 2, and it must be not touching each other and should be very, very loose. It's like number 3 is here, put like this. Number 4 is here. It's like this. But why should we like this? Very organized way, so that nobody touches with him. Then you put it here, and the 6. So all the wires should be organized like this. When you finish it, check it whether it doesn't go. You must check it. It doesn't move, so it's like this. When you finish, can you give me a drape, please? A drape. So I have to put a drape. Drape is very important for your practice. Drape gives you a comfort, modesty, and is put like this. When you finish, then you turn on the machine and you check. For the machine, tomorrow we will talk about how to take an EKG trace through the machine. Today we just discussed about the position of the electrodes. Thank you. Position of the electrodes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It must be clean, and it must be with the electrode tape. It must not move. Should be in proper position. When you finish, you have to put the drape. You have to put the drape. And so when the patient is ready, before you start the machine, you have to tell the patient the procedure is non-invasive. That means it will not give you any shock, and it is painless, no pain. you have to tell the patient. If the patient is comfortable, no talking, no moving. Patient and the medical assistant should not use any cell phone, any electronic device. If there is an electronic device with you or with the patient, that will interfere with the EKG. That will interfere. So do not use phone by yourself. Do not let the patient not use the phone. You have to motivate the patient that this process is an electrical activity of the body that is being recorded, electrical activity of the heart. So if there is an electronic device with you, that may interfere. So the result may go wrong and it will make a mess for you. So we don't want. So the patient will understand, and the patient should not keep, and you should not keep. So for today, we learn where to and how to put the electrodes. So tomorrow we will see how the machine works with this electrode and how the EKG trace. You can get a good and clean trace. So for today, thank you very much. Put all the electrodes in proper positions, all 10. 2 on the feet, 2 on the arm, and 6 on the chest. Now this will relay the electrical activities of the heart to the machine. Now we have to set the machine. When you turn on, there will be a mode. Take the mode into manual, maybe auto 1, 2, 3, 4. It's like this. And standardization mark must be 10. Like it's 5, 2.5, but we have to put it into 10. And the speed should be 25. One is 25 and 10, and we have to go for manual first. We have to check first lead whether everything is okay. So let's go to the mode again. Take manual and is lead 1. Then we press run. When we press run, there will be a lead. First we will check the number 1 is lead 1. Then we stop it and check it whether everything is okay. Now you see everything is nice, but still there is a spiky. I want to put a drip. So can anyone give me a drip? Yes, put a drip on the patient. And every time I told the drape is for warmth, modesty, and comfort. Put it down. Now let us take again another one in a manual mode. I think now it's good. Then we will turn it. The mode will be in auto 1 because it shows the lead 1. So we take this off. Then now we put the auto. Just press auto.
What are you doing? Taking it off? On?
Yes. Now it will come automatically. 1, 2, 3 is go. And you see there is one rectangular shaped trace that indicates the standardization mark is 10 millimeter, 5 and 5. That means your EKG is performing, the machine is performing good. So when it finish, then we'll see the trace. So let's wait for whole things come. How many leads we have?
12.
12 blade is 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. That's the 12 lead. But we have 10 electrodes, 2 in the feet, 2 in the arm, and 4 in the chest. That is electrode, but these are lead. Don't confuse with the electrodes and lead. Lead when it comes, it's lead. Now it's V1 is coming. So everything is nice and clean. Now we finish the trace, and I told you that when you finish the trace, it must be clean, no artifacts. And I told you that artifacts will come when there is an electronic device with the patient or with you, or there is any metallic things with the patient's body or with you. So try to avoid metallic things with the patient and try to avoid any electronic device with you on the bed. If you have a cell phone, turn it off. If patient has a electronic watch, better take the electronic watch from the body. Keep it somewhere at the time of procedure. When you finish it, you have to cut this and mount it on the paper. But before that, you have to show it to your physician or to your supervisor. When the supervisor will see it and say, yes, excellent, then you are really excellent. But if the supervisor say, it's good, but can you take another one or can you repeat it? That means you think you did some mistake. Okay, now let's talk about the common things. When you start an EKG, you take the chart, find the patient, grade the patient, take the patient into the EKG room, if there is a separate room. Then you talk about the EKG procedure to the patient. You make the patient understand what's going to do. Then you take the patient in proper positions. Then you check the machine is okay or not. Then you put the electrodes properly in place. When the electrode is placed, turn on the machine and set the machine as I showed you. Then you take a trace with the manual. If it is okay, then turn it to auto and take all the 12 lead. Then you take the trace from the machine and you turn off the machines and you mount it on the paper. Before you start, you have to write the name of the patients on the EKG trace. And the first, before, you have to write the name of the patients here, today's date and time. It's a must. If the patient has an ID, you write the ID. But in the mounting paper, you have to cut in proper length and put it on the mounting paper. You have to write all the data there. After that, you patients greet again you greet the patients or say thank you or goodbye, everything. And then you wait for you tell the patients to wait in the waiting room. Either doctor will talk about or the doctor will say, okay, not today, so any other day you come. Then, but you must thank the patient for the cooperation. So if you follow this technique, you are good. My request is that learn the EKG technique, do perfect EKG here, and then you leave the school. Before that, don't leave the school. So thank you. Thank you very much.